Okay, so I thought I'd start off this morning by explaining why research matters to me. So this glorious beach, if you're not familiar with it, is Aberavon Beach in Port Talbot, and that's my hometown. So if you look at the tourist literature that does exist for Port Talbot, the area is described as an area of grit and beauty. And that contrast is something that kind of fits really well with my experience of growing up in an area which has faced quite a lot of uncertainty, but also has quite complex social and economic challenges. So at the heart of Port Talbot, despite the often bleak statistics you see in the news, is this sense of community spirit. So within my local environment, there are individuals who have kind of made it their life's purpose to make things better for those within our community and to make people think that their voices really matter. And this is a value which is really, really strong in my identity as an academic and a researcher. Now, I am a proud first-generation academic, but finding myself working in a university as a health psychologist is a surprise to my adult self, and actually a surprise to my parents. So my dad is still patiently waiting for the day that I go and get myself a real job and leave school. Okay, he's not convinced that what I do is actually work. But I think the reason why academia is a kind of a good fit for me is it's a way to channel my inner curiosity about human behaviour. And it's a platform to share voices of groups of people that often find it hard to get their kind of feelings across. So as a health psychologist, my focus has typically been on drawn to understanding chronic conditions which are underrepresented in research. So by that I mean there's often lots of medical literature written about these conditions, symptoms or the cause of the condition, but the patient voice is absent. And I'm drawn to those type of studies where I know I can get patients' experiences across in a way that perhaps they haven't been able to give the opportunity to do so before. As a health psychologist as well, I really love a theory. Okay, we are really passionate about using theories to understand human behaviour. And we use theoretical models to understand why people engage in behaviours or often, as the case is, choose not to engage in behaviours. So that combination, alongside the fact that health research is starting to recognise how important communities are in terms of embedding health and well-being. Okay, so we can see interventions now trickling out within the community settings, and quite refreshingly, these interventions are becoming far less likely to be designed by people kind of in their ivory towers with very limited lived experience and no connection really to the communities they're designing solutions for. And rather, we see opportunities within health research to co-produce meaningful solutions with the populations that are most at risk. So that's a little bit about me. Let's switch tack now and talk about this really familiar item, which you can see on screen. So, an asthma inhaler, or if I'm going to be really technical, a meter-dosed inhaler. But for time, and for my own kind of anxiety levels, I'm just going to call them inhalers for the rest of the talk. Now, these items are really quite small. They don't take up much room in our medicines cabinet, but the carbon footprint that they have is huge. So research suggests that the inhaler contributes to around 3.5% of the carbon footprint of the entire NHS. So that's a big impact, isn't it? See some surprised faces. Now, luckily, inhalers can be recycled. They can be broken down into component parts and reused. But on a national level, so in Wales and the UK, there is no kind of national scheme to recycle these inhalers. And the project I'm going to talk to you about today took place in Swansea Bay Health Board in the Neath Valley cluster. And it was a pilot of using community pharmacies as a setting to encourage patients to recycle their inhalers. So this work was commissioned by the Primary Care Division of Public Health Wales, and we had the opportunity to collect some behaviourally informed data about patients and community pharmacists' perceptions of delivering the service within their setting, and also patients' views across Wales about how they would feel about an inhaler recycling service more generally. Now, the reasons why inhalers are particularly problematic in terms of the environmental impact is they contain greenhouse gases, and this helps kind of propel the medication down into the patient's lungs, and that's what's kind of driving the environmental harms that we see. So we were commissioned to do this piece of research, and being a health psychologist, kind of the perfect fit is the COM-B model. So what the COM-B model is, it's in a really quick explanation. It's a way of thinking about the factors that influence individuals' behaviours by breaking it down into three components. You've got an individual's perceived capability, their opportunity to engage in a behaviour, and their motivations. And the COM-B allows us to kind of tap into some of the barriers and facilitators to engaging in particular behaviours. So the data I'm going to talk briefly about today is going to be the patient data from this study. So our research assistants went to 3 different health boards across Wales and collected patients' views about the inhaler recycling pilot scheme. So we weren't able to capture, unfortunately, any patients who had been actively engaging with the scheme, but that's the lack of research, really, isn't it? But we did get some really interesting insights into what patients' views were about the availability of such schemes. So what the scheme looked like in practice is patients would be given a reminder, like a sticker on their medication package, to remind them that inhalers should be recycled, and they could return them to the community pharmacy when they were done. And then quite simply, the community pharmacy had a recycling bin within their setting, which when became full, they could send off to the recycling contractor for reuse, for safe disposal. Now, our patient data was mapped onto that COM-B model, and what we found first and foremost was the main barrier was patients had no knowledge that these inhalers were damaging. They had been conveniently just throwing them in the household rubbish for the majority of their kind of use. I think we had one patient who was burning the inhalers in their garden rubbish as well, as you do. And because of this lack of knowledge, they weren't paying any attention to community messages within the pharmacy about bringing back their inhalers or other types of medication. So they were really unaware that the services were available. They were, when the inhaler recycling scheme was explained to them, they were actually quite happy with the scheme. So they thought that the location of a community pharmacy provided the opportunity for them to engage in the scheme. It seemed like a suitable setting. The scheme was simple, so they didn't think they'd have the capability to kind of break an inhaler down into component parts for complex recycling. They were happy to simply pop it in a box when they got to the community pharmacy. And quite interestingly, the key barrier they kind of kept coming up with is they thought that this habit of putting them in the bin would be the most difficult thing to break. Okay, so we can have the intervention in the setting, but really some work needs to be done around kind of changing the behaviours of the patient group to start with. Now, they viewed community pharmacists as experts, as the right people to tell them about where to put their medication, how to safely dispose of them. But they thought the community pharmacy settings locally were quite busy. I'm a little bit reluctant they might not have the opportunities to have conversations with their pharmacists about recycling, should the schemes be running in their local settings. But the really kind of heartening thing was when you asked patients about their intentions to use such a scheme, they were all very kind of stating very high intention to engage because they thought it fitted well with their personal motivations to become more sustainable. Okay, so they had a sense there was a moral duty there to be better at managing kind of the environmental impact across their general lifestyle. So there was a lot of enthusiasm for this type of scheme. Now, I've got community pharmacy data, but I'm not going to go into that now because I can see the red flags shining at me. But what my take-home message is, the first thing is the COM-B model is a nice, neat package to use if you're thinking about embedding sustainability into your practice. And it's a good way of exploring patient or community views of the interventions that you're designing. The main key take-home message, though, I would say, is if you do have a blue inhaler, don't chuck them in the bin. So thank you to the rest of my team.